Jain. Myself, JVN Dr. Ravi Jain, Associate Professor and HOD, Department of Practice of Medicine in Faculty of Homeopathic Science at JVWU Women's University, Jaipur. In this series of lectures, we have been discussing about the various diseases related to the locomotor system. In today's lecture, we are going to discuss about another important disease condition, that is rheumatoid arthritis. In the last lecture, we have discussed about osteoarthritis. What is osteoarthritis? What are the common clinical features? Investigation and management of osteoarthritis. Today, we are going to discuss about rheumatoid arthritis. What is rheumatoid arthritis? How it is caused? What are the clinical features of rheumatoid arthritis? What are the deformities, common deformities of rheumatoid arthritis, and how to investigate a case of rheumatoid arthritis, and also the management of rheumatoid arthritis we are going to discuss today. So let us start with rheumatoid arthritis. What is rheumatoid arthritis? Rheumatoid arthritis is basically a chronic inflammatory disease condition of the joints. It is affecting joints, chronic inflammatory condition of the joints that is causing symmetrical, peripheral, polyarthritis. Multiple joints are involved, symmetrical joints are involved, and the joints are involved and they become inflamed. As we have discussed in osteoarthritis, osteoarthritis was a non-inflammatory condition, whereas rheumatoid arthritis is an inflammatory condition. Here we have inflammation of the joints. Inflammation of the joint are present. Now, this is basically what is there. There is chronic inflammatory disease condition of unknown etiology. We do not know the exact cause. Why? What is caused by the rheumatoid arthritis? This is a multi-system disorder. In case of rheumatoid arthritis, not only joints are affected, but multiple joints and multiple systems are also affected. We have articular manifestations, we have extra-articular manifestations that are present in the joint, in the disease condition. Rheumatoid arthritis is characterized by three things. We have three things that are present in the rheumatoid arthritis. As we have discussed in osteoarthritis, there are three things that are present in case of rheumatoid arthritis. We have cartilage destruction. There is destruction of the cartilage, bony erosion, that is erosion of the bone, and joint destruction. These are three things that are present in case of rheumatoid arthritis. In rheumatoid arthritis, we have three things. We have cartilage destruction, we have bony erosion, and we have joint destruction. We have discussed in the similar way in case of rheumatoid osteoarthritis, where there were also three things: focal loss of hyaline cartilage, proliferation of the new bone, and remodeling of the joint contour. So this is the rheumatoid arthritis. Let's again go back to this PPT. Now, here we have joint involvement. There are multiple joints are involved. The cartilage destruction is there, multiple joints, and the most important thing is the joints are involved symmetrically. There is symmetrical involvement of the joint condition. There is intermittent exacerbations. Now, what happens in case of rheumatoid arthritis is, now what happens? The disease comes acutely. There is acute exacerbations of pain in case of rheumatoid arthritis. When the pain is coming suddenly, affecting the small joints, there is inflammation. Inflammation and swelling of the joint are present. Inflammation plus swelling of the joints are present. When the joints are present, they become swollen, and there is restricted mobility, that is stiffness. Stiffness of the joint is present. Now, stiffness is present. In osteoarthritis also the stiffness was there, but in case of rheumatoid arthritis, the stiffness is more than 1 hour. In osteoarthritis, it was less than 30 minutes, and in rheumatoid arthritis, we have stiffness for more than 1 hour. The stiffness is present, the inflammation, the swelling is present, and now, who are affected? Osteoarthritis was a disease condition of old age, whereas the rheumatoid arthritis is a disease condition of comparatively young age group. 25 to 55 years of age group are most commonly affected by rheumatoid arthritis. Whereas osteoarthritis, the age group was more than 50 to 60 years. It was uncommon below the age of 40 years, whereas rheumatoid arthritis is more common in the young population. Now, because this rheumatoid arthritis is affecting the young individuals, it is having articular, means joint, and extra-articular features. Therefore, this is more serious. Rheumatoid arthritis is a more serious condition in comparison to the rheumatoid arthritis. Alright, now what happens? This is more common in young people. Both environmental and genetic factors play important role in this particular disease condition. Now what is happening in case of rheumatoid arthritis? This is the healthy joint. Now, as I have told you, there are three changes that are taking place in case of rheumatoid arthritis. In case of rheumatoid arthritis, there is destruction of the cartilage, there is bony erosions, and there is a destruction of the joint. So what is happening is the cartilage of the joints are wearing. There is inflammation of the synovium. You can see the red mark as inflammation. Inflammation is a marked feature of rheumatoid arthritis, and there is reduced spaces, and there is destruction of the joint. What happens? The important thing you must remember is the pannus formation. Pannus formation is the typical feature of rheumatoid arthritis. This is the healthy joint. Now, what happens is there is pannus formation. This is the pannus formation that you can see. There is infiltration. Now, what happens in rheumatoid arthritis is, in case of rheumatoid arthritis, the pathophysiology. There is inflammation of the joint, and the joint is infiltrated by T lymphocytes, B lymphocytes, macrophages, which initiates the inflammatory response. This T and B lymphocytes are responsible for making immunoglobulins that forms the rheumatoid factor. This rheumatoid factor is a keynote or key feature of rheumatoid arthritis. Alright, so we have this infiltration of the joints that leads to formation of the pannus formation takes place. This, you must remember, this pannus formation is a typical feature of rheumatoid arthritis. Alright, next, nodules. Another typical feature of this rheumatoid arthritis is the formation of nodules. You can see subcutaneous nodules that are present in case of rheumatoid arthritis. We have told that the clinical features. Now let us discuss about the clinical features of rheumatoid arthritis. This was the pathophysiology when there is destruction of the cartilage, destruction of the joint, and destruction of the bone. Now, what are the clinical features of rheumatoid arthritis? We have discussed, number one, there are both articular and second is extra-articular manifestation. Articular related to the joint and extra-articular related to the other systems of the body. Other systems which includes the eyes, we have eyes, heart, lungs, skin, kidneys. All these organs are also affected by rheumatoid arthritis. Rheumatoid arthritis is affecting multiple systems of the body, and in case of rheumatoid arthritis, the death occurs because of the heart condition. The heart cardiovascular diseases are responsible for the death of the individuals. So let us discuss the clinical features of rheumatoid arthritis. Number one, there is pain and stiffness. First of all, there will be pain and stiffness of the joints. Number two, there will be restriction. There will be pain. The pain and stiffness will be more than 1 hour of an individual. The pain will be coming suddenly. There is sudden or acute onset of the pain. There will be signs of inflammation or redness. The pain is coming suddenly. The patient becomes very much restless because of the pain. And these are not self-limiting pains. They remain for a very long period of time because of the inflammatory process that is going on in the individual. The important thing is presence of the rheumatoid factor. Another important thing that is present in case of rheumatoid arthritis is presence of anti-CCP antibodies, cyclic citrullinated protein. This is also present. Now these are the articular manifestations. Let us discuss about the extra articular manifestations of the rheumatoid arthritis. In the eyes, it is producing Sjogren's syndrome. Sjogren's syndrome, basically a disease condition where the eyes and mouth becomes dry. The tear glands and the salivary glands are destroyed because rheumatoid arthritis is an autoimmune disease where the cells, our own cells, are getting destroyed. Therefore, in the eyes we have Sjogren's syndrome. In the skin we have cutaneous nodules. These nodules are the key feature of rheumatoid arthritis that we have seen. I have just shown you the nodules, the cutaneous nodules. These are the nodules that are usually present in the skin of the patient. So the skin, the hands are affected, the lungs are affected, the heart. I have told you that because of the heart disease condition, maximum deaths takes place. Alright, this is the stages of rheumatoid arthritis. What is happening? I have just told you. This is the normal structure. There is inflammation of the joint, then inflammation plus pannus formation. Pannus formation is important. Destruction of the cartilage is there, destruction of the bone is there, and the fusion of the bone takes place at the end. Thus, the joints becomes immobile. Now let us discuss about the deformities. There are different type of deformities of the rheumatoid arthritis. Let us discuss them one by one. This articular and extra articular manifestations I have already discussed with you. Now deformities. Deformities are very important because there is permanent damage to the joint structure. Now you can see this. This is basically the swan neck deformity that is usually seen. Other deformities, we have boat honorary deformity, Z-line deformity, piano key movement, and flat foot. This is basically the deformities of the hand that we are going to see. This is the flat foot and cock-up knee deformities. Cock-up toe deformities, these are also present in the individuals. Next we have extra articular manifestations. What are extra articular? I have just told you that other than the joint or the bony or joint complaints, we have different conditions like neurological manifestations are there. Eyes and mouth is affected, that usually forms the Sika syndrome, Sjogren's syndrome. Vasculitis is there. The rheumatoid arthritis is also affecting the blood vessels, that leads to development of vasculitis. Osteoporosis is there. Endocrine, in the skin there is nodules formation. Pulmonary, we have pleural effusion. Heart, we have pericarditis. Pericarditis is the most important disease condition that is responsible for the death of the individuals. We also have Fatigue syndrome, lymphoma, and we have associated conditions of rheumatoid arthritis that includes the osteoporosis and hypogonadism. So that was the extra articular manifestations. Now investigations. How to investigate a case of rheumatoid arthritis. Whenever a person of rheumatoid arthritis is coming to us, there will be a history of pain and stiffness at a very early age, the age when we are not expecting. The complaints will be appearing at 25 to 55 years of age. The pain and stiffness is there. Alright, there will be swelling of the joint. There will be severe pain, severe acute pain that will be observed in case of an individual. Alright, so these are the articular manifestation. Other manifestation includes there will be dryness of the eyes, dryness of the mouth. You can see the subcutaneous nodules. These from this clinical history we can diagnose that the patient might be suffering from rheumatoid arthritis. Other clinical features involve X-rays for the diagnosis. X-ray is very important of the affected joint. X-ray will show the deformities, fusion of the bones. Another important factor is the rheumatoid factor. Rheumatoid factor is present in case of rheumatoid arthritis. Anti-CCP antibodies. Anti-CCP antibodies, this is the key feature of rheumatoid arthritis. This is the most important feature that will be seen in case of patients who are suffering from rheumatoid arthritis. Anti-CCP antibodies. Apart from this, because this is an inflammatory disease, therefore ESR will be raised. So ESR will be raised, anti-CCP antibodies and rheumatoid factor. These things will be raised. Apart from this, for the diagnosis of the extra articular manifestation, we have to check for the various functions. We have to go for the lung function test, liver function test, for the heart functioning test. We have to check for various deformities. For the kidney, we have to go for the various lab investigations for checking the renal function test also. So various indicative tests for the extra articular manifestations has to be done. Now we come to the management part. The management of rheumatoid arthritis. How to manage a case of rheumatoid arthritis? Because we know pain and stiffness are the most important features, therefore analgesics have to be given. Non-steroidal anti-inflammatory drugs should be given. Another drugs that reduces the pain includes the DMARDs, that are drug modifying anti-rheumatic drugs. Disease modifying anti-rheumatic drugs should be given. Other than for extra articular manifestations, we have to give the indicated treatment. Indicated treatment related to the disease condition. Suppose there is dry eyes, then we have to give topical emollients that can make the artificial tears. For dry mouth, we have to give accordingly. For subcutaneous nodules and all the other disease condition, we have to manage the case accordingly. Next, we come to the homeopathic management. Homeopathic management. Homeopathy plays a very important role in the management of rheumatoid arthritis. There are various homeopathic medicines that can be given in the disease condition for the pain relief and also for stopping the progression of the disease condition, because this is a very severe disease. Rheumatoid arthritis, as it is affecting the individuals in a very young age, therefore it is affecting the individuals at a very large scale and very severe condition. After the diagnosis of rheumatoid arthritis, almost 20 to 30% people becomes very much severe within 3 to 4 years of diagnosis. So the disease is progressing very fast. If the disease is diagnosed at an early age, then the prognosis becomes very much poor. So the homeopathic management includes various medicines like arnica. We have arnica montana for pain relief. We have Bryannia alba. We have Dalcamara. We have Euphrasia for the eye complaint. Whenever there is dry eyes, we can give Euphrasia. Alright. We have Gelsemium. Gelsemium also offers some sort of pain relief. Rustox, Rhododendron, and we also have other medicines that can be given on the basis of symptom similarity in case of rheumatoid arthritis. So these are the disease conditions for which we can give the homeopathic medicines. These are the treatment. In extreme cases, a surgery, that is surgical treatment, that can include the joint replacement, can also be done. Homeopathy, we have Arnica, Aurum Med, Belladonna, Calcarea Calm, Causticum, Calcarea Flor, Dulcamara, Calibicrone, Calicarb, Calmia, Pulsatilla, Rhododendron, Rustox and Ruta. These all medicines can be given. So let us again see what is happening in case of rheumatoid arthritis. It is a chronic inflammatory disease of unknown etiology that is characterized by symmetrical peripheral polyarthritis. Multiple joints are involved. This is the pathophysiology that is taking place. The most important thing you have to remember is the formation of the pannus. Pannus, there is infiltration of the T cells, B cells, neutrophils, macrophages. All these cells are infiltrating the joint and they are destructing. They are destructing the cartilage, they are destructing the bones, and they are destructing the joint, leading to the joint formation. This is the process of joint formation, fusion. Here you can see the joint fusion leading to permanent deformity, permanent disability. These permanent disability are responsible for the various permanent deformities like swan neck deformity, Z-line deformity, flat foot and cocktail. These are the extra articular manifestation. The person is not only affected on the joints but also affected by the other systems of the body. So this was all for today. I hope you must have understood the session properly. In the next lecture we will be meeting with a new disease condition related to the locomotor system. So this was all for today. Thank you very much. Have a good day.